Well, COVID restrictions are once again changing in Ontario. As of today, a number of rules are being relaxed. Things are going to loosen up even more on March 1st when the province plans to get rid of the vaccine passport program and lift remaining indoor capacity limits. Janet DeMille is Thunder Bay's Medical Officer of Health. She's here to discuss what that means for us. Dr. Janet DeMille, good morning.
Good morning, Matt.
Thank you very much for being here. We always appreciate you making the time. What was your reaction to the province's announcement about just how quickly and to what extent restrictions are being lifted?
I think probably my first reaction was to feel a little bit nervous. I didn't really have a lot of heads up when that was announced, although we did, obviously it was in the news, heard sort of rumblings that it might happen, but didn't necessarily have the details until Monday morning. And, I actually, though, think that it's really exciting that we're actually talking about reopening, that we've already started to reopen, and that there's more opportunities coming up. We are definitely on the downside of this particular wave, and even though we're still navigating that downside, it is reasonable to be talking about reopening and reducing some of those restrictions. I think probably where I felt nervous, and I watch the numbers in our area very closely, is I have found that even though we're on the downside, our decline has been slower than I would have liked to have seen. There's a lot of day-to-day fluctuation, and of course with the testing changes, I don't necessarily have a concrete picture as I would like to have, but it overall, what did seem that things were going a bit slowly, and I preferred, and we were a little not quite declining at the rate that other areas like Southern Ontario were declining. So, and with respect to the restrictions and the removal of the restrictions, I'm not too concerned about the reopening things that are happening today. Perhaps I would have, I think, preferred to stay on the original plan that the government had released in January, where the next step would have been March 14th instead of March 1st. I feel like that, there's not a lot of time between the 17th and March 1st to really sort of navigate any implications of the reopening that's happening today. But at the same time, we are on the downside, and I think we have navigated this collectively, I think, very well, notwithstanding, some people requiring hospitalization, but I think we'll continue to do that.
Across the province, they're actually tracking wastewater to track COVID-19 numbers. This week, the Science Advisory Table shared data that shows a downward trend in those indicators for pretty much all parts of the province except Northern Ontario. What does that tell us?
So this is, one of the indicators that can be used, and we do get data from the Thunder Bay wastewater surveillance, and expecting some today, so I'm hoping that will show a nice decline, I did see what was out on the Ontario Science Table, and I think it's important to realize, that's across the north, and it's not necessarily what's happening here in Thunder Bay right now. We haven't seen that sort of uptick. Again, we've seen something that's perhaps been a little bit slow to drop, but not really seen an uptick here. So I'm hoping I'm not going to see that today. But I think it probably, though, indicates, and you were talking about this a little bit earlier, about, the north maybe being a little bit behind. We haven't quite seen the drop that other areas have, the implications even for Thunder Bay, but of course for those First Nations communities, we're still navigating that. And so wastewater is one of those indicators. With respect to the Thunder Bay wastewater, what we've seen, we saw a very substantial peak around, I think it was January 10th. And then since that time, and the samples are done three times a week, and then it takes sometimes up to a week to get the results back. So it's always sort of looking a little bit in the past. And the numbers do tend to go up and down a bit, and sometimes hard to explain the individual ups and downs. But it has, again, I've seen it trending downward as well. Same with our case numbers.
It does seem that at least up in northwestern Ontario, we're about a couple months behind what is happening in the rest of the province. Pretty much for this whole pandemic, it would be lots of cases in southern Ontario, and then that wouldn't reach us until later on, and we kind of come in waves like that. If our metrics aren't falling the way that they are in other parts of the province, does that tell you that it could be too early to lift restrictions in our region, or are we at the point where maybe it's just a case of we need to be more careful?
So I think we need to realize that, lifting the restrictions doesn't mean that everything's safe and we're all good to go, right? Like, it's taking the next step. And and you know what? That it could mean that Omicron will spread more. It could potentially mean that our numbers will go up a little bit, right? I had wondered, if maybe our slower decline, slower than I had expected, may be due to the fact that schools reopened and that we already did some reopening, right? And that may have maybe prevented a more steeper decline. So, but at the same time, there are things that are on the good side. We have a high immunization rate. We've had a lot of people come forward for their boosters, that third dose, and we know that third dose will protect people against infection. 2 doses, very good against severe outcomes, but didn't protect so much individuals from getting infected. But 3 doses really show protection against infection, and we're at almost at 60% of people 18 in age and older. So that is protective. Also, people, it's been maybe hard-earned immunity, but many people have had COVID in our area in the past 6 weeks. And when I listened to Dr. Uni talk about, perhaps 4 million Ontarians may have had COVID, that would represent about 40,000 people in our area. So potentially, if Dr. Uni is true with that Ontario result, and we're about 1% of the population in the Thunder Bay District Health Unit, and that would be 40,000 people have had, up to, and that would actually give them some immunity and some protection, and will help reduce any increases. And even if we did see a little bit of an uptick, I would expect to see that drop fairly quickly after a reopening as well, though.
There was a recent post on the Health Unit Facebook page saying the most common questions that you're getting these days is about isolation. From the number of calls you're getting, do you have a sense of how common that experience of having to isolate is right now?
So I think what our calls, we do get calls, but I think there's a lot of people that don't call us, which is good because we only have a few staff available to do that. But I think there's the part of navigating through this Omicron wave, and it will continue to be part of it, right? Is to stay home if you're sick. If you have COVID, stay home. Your household members, of course, should stay home as well, and isolate for a period of time. And if somebody has symptoms, they should stay home and isolate, and their household members should isolate. And I think what our calls are telling us is people are really doing that. And I don't think we would have, I think there's a lot of people out there that are probably even listening to me right now saying, isolating because somebody in their household maybe has symptom or has COVID, right? And, I think the questions that we're getting are people that are just trying to understand how long that they should isolate for, because there's all sorts of little criteria and timelines on that. So we often refer them to our website or to the provincial website. And the general rule, if somebody has COVID or somebody has symptoms, it's 5 days if you have had at least 2 doses of the vaccine. And your household members should isolate as well, because you should just assume that it's COVID, and it does spread very quickly in the household. And if any additional person gets symptoms or sick, then that sort of resets the clock for the household. So you have to kind of go for 5 days from that point as well. And that, that's kind of, people are sort of navigating through that.
Dr. DeMille, we always appreciate you making the time to come and chat with us. Thanks once again.
Thank you for the opportunity, Matt.
Dr. Janet DeMille is Thunder Bay's Medical Officer of Health.